About 3.5 years back, I had a very bad dark spot in my life. Didn't want to live anymore, didn't want to care about myself no more. I went from being homeless to continuously being homeless to where I was self-destructing myself. I didn't think anybody would love me, and I'd lost everything, and it was all a choice of drugs. And one day, I was in a hallway, and I had drugs in one hand, and I had a prayer in the other. And I was crying, and I looked at the drugs in my one hand, and I listened to the prayer in my other hand, and I went with the prayer, and I threw everything in the trash can that day.
One day we were sitting around going, as we look at the spiritual leaders of the church, how do we give back to them? And their response was through the homeless and mental health.
It is undeniable that homelessness is increasing in Kern County and continuing to grow. You see it in every corner of our city, every corner of our county. California is experiencing a homeless crisis, and Kern County is just not immune to that.
People see homeless people and say, this individual needs to be homeless. But in reality, if you really ask, you'll find people who have mental health issues. They may have substance use issues. So I think it's incumbent upon us that we remove that stigma from the homeless and look at them as human beings.
And now the homeless count comes up, and we know we need to play a role in that. So Adventist Health said we'll step up. The more that we can help in that count, the more resources we can help bring to Kern County for the homeless population.
Here in Kern County, we do the point-in-time count in a way that we're not just going out and counting individuals, we're actually surveying them, we're engaging with them, partnering with an organization like Adventist Health that truly believes in living God's mission outside the walls of the hospital. That's life-changing for the people that we serve.
It's a community effort, and it needs strong leadership. It's important that they partner with a lot of organizations, because one organization cannot do it all.
There's this thing that we don't want to miss in taking care of the whole person and every part of them that makes them whole. And healthcare is a major part of that.
At Adventist Health, we may have given a lot, but I will tell you, we've received a lot back just from the community coming together, the entities coming together. What an opportunity to walk the walk and talk the talk.
I've been homeless for so long. This is my first time not being homeless. This is my first roots, like grounds, like a church and a job, and I have my own home, and I have a cat and my kids. That's so weird. I work at Adventist Health. I work in transportation. And what I do for people is not just push people around. There's prayers, there's talking, there's getting to know people one-on-one on a basis. You just never know. It's a personal feeling.
Seeing somebody struggling, are you gonna walk away from that individual? Imagine the roles are turned and it's you. How would you think you would feel when people walk away from you? In the end, we're all gonna stand before God. We're gonna all have to answer to our action. What we've done on this earth to help people. You really cannot walk away.